Hi, in this video, I'm going to talk about the Wigger's diagram. So Wigger's diagram, we are focusing on the left side of the heart. So before that, I would like to introduce the color that I'm using. So the orange will represent your aorta, and your green will represent your ventricle, and blue will represent your atrium. So before I start, I would like to introduce the diagram that I'm drawing. So the diagram above would be the pressure diagram, and the diagram below would be the left ventricular blood volume. So let's get started. So I would like to start off with the ventricular diastole, which takes about 0.5 seconds. So during ventricular diastole, so I will just start from the passive ventricular filling, so up to this point. The passive ventricular filling, as you can see, the linear relationship of the lines. The lines are all linear. Why? So, as you can see, during the ventricular passive filling of the ventricle, what happens is that you will have the blood returning from the lung, from your lungs, from the true left and right side of lungs, returning through the pulmonary veins and into the left atrium. So there is no valve in between the pulmonary veins and left atrium, so that's why the blood traveling from the left pulmonary vein and right pulmonary vein into the left atrium is directly into the right atrium. And you have to remember that it's the blood that exerts a force against the wall of the chamber, in this case is your atrium, and giving rise to the high blood pressure. So the blood entering from the pulmonary veins into the left atrium give you a high blood pressure. So that's why you have higher blood pressure in atrium than your ventricle. So these higher blood pressures in your atrium will push open the mitral valves and allowing the passive filling of the ventricles during the diastole of the ventricle. So during the passive filling, remember both your atria and ventricles, they are relaxing. Okay, so you can see an increase in the atrial pressure and at the same time your ventricular pressure. Why your ventricular pressure is increasing? Because the blood is entering into the ventricle. So whenever there is a blood entering into the ventricle, the blood will exert the pressure against the wall of the ventricle, and hence giving rise to increasing blood pressure. So now what happens to the aortic pressure? Why the aortic pressure is decreasing? This is because the blood ejected from the left ventricle to the aorta, the bloods are leaving from the aorta to the large arteries. So whenever the blood is leaving the aorta, the blood is no longer exerting the force against the wall of the aorta, and therefore the aortic pressure is decreasing. So then we move on to the left ventricular volume. So there is an increase in left ventricular volume linearly due to the passive filling. So now we move on to the atrial systole. So during the atrial systole, you can see there is a curved shape, which is shown like that. There is a curved shape. So what happens to this curved shape? What does this curved shape show you? So this curved shape shows you that the gradient is decreasing. The gradient of the curve is decreasing. Why? Why the gradient of the curve is decreasing? First, you have to recognize that atrial contractions is used to eject the blood, the last bit of blood that left in the atrium into the ventricle. So when atrial contract, the pressure is decreasing. Due to that, more and more blood are leaving from the atrium into the ventricle, and that's why more and more blood is lost from the atria, and lesser force of the blood is exerting against the wall of the atrium, and therefore the increase in the atrial pressure is getting lesser and lesser and lesser. So the rate of increasing in atrial pressure is decreasing. So this happened to your ventricle also. Why your ventricle is showing a curve as well? This is because more and more blood is entering into the ventricle. As you know that the atria is ejecting the blood from the left atrium to the left ventricle. So the blood pressure experienced by the atrium is transferred to the ventricle because the blood is flowing from the atria to the ventricle. That's why there is a curved shape experienced by the ventricle as well. So the curved shape also showing you the lesser and lesser step in the gradient. Why? Because the last bit of blood that is pushing from the atrium to the ventricle is getting lesser and lesser and lesser. So the increase is getting lesser and lesser and lesser. This is just the same meaning or the same concept as in the left atrium. So same thing happen to your aortic pressure, is just keep decreasing because the blood is leaving from the aorta. So what happened to your ventricular volume? So there is a steep increase, can you see? A steep increase in ventricular volume and then followed by a plateau. So why there is a steep increase in your ventricular volume? Because your atria is coming to place. Your atria contract. So more blood can be forced during a short period of time. But it's getting a plateau after that because lesser and lesser blood entering from the atria. So then we move on to the ventricular systole. So during the ventricular systole, as you can see, from this point up to this point, once your ventricle has a pressure which exceeding your atria, your AV valve will close. Can you see at this point, your AV valve, which is your mitral valve, will close. Why? Because you have higher ventricular pressure, which push against the backflow of the blood, push against the mitral valve, closing the valve. And therefore, you will have a sound which is known as loop. So remember, whenever you are oscillating or listening to the heart sound, it would be the sequence of loop, doop, loop, doop, loop, doop. So as you know, loop is for the first sound. So what is the first sound? The first sound is your AV valve closing. So it's loop. So doop is for your semilunar valve closing. So during this period, can you see there is no increase in the ventricular blood volume? Why? Because both valves are closing. Why they are closing? Because your ventricular pressure haven't reached higher than your aortic pressure. So that's why both valves are closing. Both valves are closed during this time. So during this time, we know it as isovolumetric ventricular contraction. And you have to remember that during this time, it's also the isometric contractions of your ventricle. That means your ventricular muscle is developing the tension, but the muscle is not shortening. Why? Because you know that your blood is like water, is incompressible. So the ventricle is contracting, but your blood is less ability. There is a less ability for you to compress the blood. It's just like water. They are incompressible. They are incompressible. So they are incompressible. What happens is that you are forcing, just like we imagine you are pushing a wall. So you are pushing a wall. The wall is not moving. Okay? Because the wall is incompressible. So still your muscle is developing tension, but your muscle is not shortening. So that's why this is happening in the left ventricle during the isovolumetric contraction. So then we move on to the ventricular pressure. So the ventricular pressure, once it reach higher than the aortic pressure, you will have the opening of the aortic valve. Okay? So the opening of the aortic valve allowing the blood from the ventricle to be ejected into the aorta. So what happens is that your blood volume is decreasing. So again, it's showing a curve. Why? Why is it always showing a curve? Because this curve is showing you that the gradient the gradient is getting less steep and less steep. Why? Because the volume of blood you ejected out is getting lesser and lesser and lesser and lesser in the ventricle, because you ejected more and more and more and more to the aorta. So that's why the volume is getting lesser and lesser and lesser. As you can see, the decreasing in volume of blood, the rate of decreasing in volume of blood in the ventricle is decreasing due to the gradient is decreasing. So must be curved downward. Okay, so then we move on to, as you can see, there is an increase in atrial pressure here. Why there's an increase in atrial pressure? This is due to that the backflow of blood in the ventricle that pushing against to close the mitral valve is exerting the pressures onto the mitral valve. So whenever it exerts the pressures to the mitral valve, it will affect the pressure that the backflow of blood is exerting on the mitral valve is also transmitted to the atria. So that's why you can see an increase in pressure of the atria. This is due to the backflow of blood from the ventricle to close the mitral valve. And whenever it closes, it exerts the pressure to the valve. So it pushes close. So when it pushes close, it's at the same time it transmits the pressure, it transmits the force to the atrial wall. So atrial wall was showing a brief rise in pressure. Okay, so then we move on to the ventricular diastole. So the ventricular pressure is decreasing when more and more blood is forcing out. Okay, when more and more blood is forcing out, when more and more blood is leaving the ventricle, your ventricular pressure will decrease. Why? Because there are lesser and lesser blood exerting pressure to your ventricular wall. Okay, but you have to remember there is still some residual volume left in the ventricle even after ejecting. So you just have to remember, once the blood during the diastole, so at this time, this volume during the isovolumetric contractions is known as end diastolic volume. Okay, so then you will have aortic pressure is rising. Why aortic pressure is rising? Aortic pressure is rising. This is due to that the blood is flowing through it. Whenever the blood is flowing through a blood vessels, you have to remember the blood will exert the force against the wall. So whenever it exerts the force against the wall, it increasing the blood pressure. Blood pressure is simply means that the blood is exerting the force against the wall. So that is known as blood pressure. So the blood pressures in the aorta is increasing. Why? Because the blood is ejecting out from the left ventricle to the aorta. So the aortic pressure is increasing. So once your aortic pressure increase and your ventricular pressure drop below it, at this time you will see an aortic valve is closed. So the aortic valve is closed, showing, so you are using the stethoscope, you can hear the sound of doop. Okay, so in this time, again, both valves are closing. Your ventricular pressure is still higher than your atrial pressure. So this will give you an isovolumetric relaxation. So isovolumetric relaxation is your end systolic volume. And the difference between the end diastolic volume and the end systolic volume we are referring to the blood remaining in the left ventricle after the ejection. So the difference between them will give you the stroke volume, which is your stroke volume. Okay, so what happened is that, as you can see, there is a notch here, which is bulging upward. Why? Because there is an elastic. So as you know, aorta is a large elastic artery. So the elastic recoil of the aorta and the rebound of the blood against the aortic valve, that means the rebounding of the blood against the aortic valve, will give you this notch, which is known as the dicrotic notch. So why your aorta is recoiled, elastic recoil of the aorta happens, this is because the wall of the aorta is expanding to allow more blood to entering to the aorta. Because when you eject the blood, basically the aorta will slightly increase in its lumen. So after the blood, whenever you stretch the aorta, the wall of the aorta, there is a force that will recoil back the aorta, because aorta is a large artery with more elastic tissue. So the elasticity of the aorta will allow the aorta to recoil after it is stretched by the blood that passing through it. So when it stretch, it will recoil back. So when it recoil back, it gives a force. That's why you have a rise in pressures in the aortic pressure. At the same time, this dicrotic notch is a combination of the force caused by your elastic recoil of your aorta, and of course your blood that rebounds against the valve. So you have the semilunar valve here. So your blood, remember you have the aorta. Remember, the closing of the valve, the aortic valve, is not caused by the backflow of the blood. It is caused by the vortices that is formed. So the vortices that is formed to close the aortic valve. So vortices is something like, whenever you have this is your aortic valve. So the aortic valve is designed, the aortic valve or valsa valve, something. So the aortic valve is designed with 3 cups. So what happens is that when you're forcing a blood through a narrow space, there will be a vortex forming. So it's this vortex that form to close the aortic valve. It's not like other valves in it's different from the valves that we mentioned, like your AV valves. They are closed is due to the backflow of the blood that closing it. But for aortic valve, it is due to the vortices that is formed that close the aortic valve. And of course, there will be some backflow of the blood and then of course there is a backflow of the blood that applying the force to close the valve as well. But the main thing that close the valve is due to the vortices. It's the vortices that when you force a fluid through a narrow space, which is in this case your aorta, and there will be a vortices that form, and it's the vortices that close the valve. And of course there will be a backflow of blood that even applying a pressure or force to fully close the valve. So the backflow of the blood or the rebounds of the blood against the elastic wall will also contribute to the dicrotic notch, to the increase in pressure of the aorta. Okay, so then we move on to your ventricular volume. So the ventricular volume during the ventricular diastole, as you can see, once the atria exceed the pressures of the ventricle, there will be an opening of the atrial ventricular valve, which is your mitral valve. Why? Because the blood returning from the lung entering through the pulmonary vein is giving the blood coming back from the lungs to the left atrium is giving a force to push open the AV valve, and the blood that coming back or returning from the lungs to the pulmonary veins are exerting pressure, are exerting force against the wall of the atrium. This leads to the increase in pressure, as shown it here, the slight increase in pressure of the atrium. Okay, so the increase in atrium pressure is due to the blood returning from the lungs through the pulmonary vein. So once the AV valve is opening, there will be an increase in volume. Same thing happened to this curve. The increase in volume of the ventricle, the rate of increase is decreasing because more and more blood is carried from the atrium to the ventricle. So overall, to understand this curve and to know how to draw this graph, first thing you have to know about blood is exerting pressure, is exerting a force against the wall of the blood vessels. So once you know this concept, you will be able to draw the graph. Okay, that's all from me.